Call this meeting to order, 10:01, Thursday, February 29th, 2024. We're here to get a check-in on our advanced benefits with Mr. Yost. So I'll turn it over to you, sir.
Okay, thank you very much. And this is just kind of somewhat of an informal meeting, just to touch base. Got over the holidays, into the new year, and just see how things are going on the benefit side. If you guys are hearing any feedback, make sure the plan's working well. It's working well on our end with the GEM plan. So I'll assume that no news is kind of good news.
I haven't heard anything negative.
Because bad news travels pretty fast.
People are very quick with that.
They are.
So, we haven't heard anything. I have.
Sure. Excellent. Well, in my conversations with the GEM plan, overall speaking, the pool is trending pretty good right now. But we have a few months in that claims process, so time will tell. But I will certainly, if there's any red flags, I'll certainly reach out to you folks and let you know what that looks like. But generally speaking, the trend is still, the inflationary trend is still anywhere from 7 to 10% in the state on the medical inflation side of it. So basically, simply what that means is that the plan that we offer last year is just increasing by that inflationary factor this year. However, that does not mean that we're going to get an 8% or 10% increase on the plan. That's just the inflationary factor. There's a number of calculations that come into play from an actuarial standpoint to calculate that final renewal number. Right? So we're just very premature at this time.
Okay.
But the good news is, as the pool within the GEM plan seems to be trending pretty well from a claim standpoint, so
right.
that's always positive.
Good.
Right?
Yep.
So it's of course the inflationary factors, and I think everybody here is pretty wily to what's happening in the prescription drug realm. Right? We've seen substantial increases there as well over the past year, so that all plays into it. So. And in our area, with the influx of people, their services are stretched to their limit on a number of levels, and that certainly trickles down to the hospital and care providers and whatnot. So,
we've already had the discussion with our ambulance board on pharmaceuticals going up quite a bit.
Okay, sure.
So, we're kind of.
Yeah. So, I did bring the latest experience report. Let us take a look at that.
You still produce the most colorful reports we receive all week.
Yeah, thank you.
And the graphs really help.
Yeah, they help me a lot. So, at the end of the day, each month, it's ebb and flow. Each month we trend a little bit higher, a little bit lower. So at the end of the day, it's what this looks like once the GEM plan and their actuaries do the final calculation on not only just Shoshone County but the pool in general. Mm-hmm. So what I see here is we're trending a little bit high, but I don't see anything really alarming at this point. So that's good news. That would bode well for our contribution to the calculation of the GEM plan pool overall.
Okay, now is this the graph, is that just our county?
Yes.
Okay. It's not the whole. Okay.
Correct. Yeah, that, it would be nice if I had access to the entire claims information with the GEM plan, but unfortunately I don't.
Okay.
They keep that pretty close, and for good reason.
Yeah, I would understand. Yeah.
Yes, sir.
Yeah.
But it sounds like the GEM plan is in a position for additional COVID funds again this year. So how that parlays into the renewal is really, and we've seen this over the last year or so with a number of self-funded plans, but it just really offsets the renewal. So, depending on claims, what the renewal adjustment may be, apply COVID dollars, and then, but in the true sense, I would say that that is an artificial application, right?
Yeah, because you might not get it next year.
Exactly. So, but we see that. We've seen it with a number of self-funded plans. So.
Tracey, do you have any extra copies?
I do. Here, I think I did.
You want to see me?
You know what? I was thinking ahead a little bit here. I brought two more. Does anybody else like that? Thank you. Yeah.
Did you want one?
Okay.
I'd share with you.
And I based on our last conversation, we talked a little bit about wellness program and how that might be applicable to the county. And, I reached out to the GEM plan to see if they had anything specifically designed that we could kind of cookie cutter that would work here. And at the end of the day, they don't. The short answer is on that. And it kind of goes to what we talked about at our last meeting. If you recall, implementing a wellness plan to try to get in front of, some of the claims it's just difficult, right? We talked about having an internal team or champions that really push that wellness program to get everybody involved and get everybody engaged. And at the end of the day, I think the cost that would be incurred to implement the plan, in addition to the possible financial incentives, because largely a number of wellness plans are tied to financial incentive in some fashion, right? That motivates the employees to do that. I think, and I think you'd indicated last time we spoke that we really don't have, the county doesn't have a lot of money to really look at that. And at the end of the day, the idea sounds really good, trying to get in front of those larger claims. But when you look at some of the claims that are really affecting our plan, like the multiple sclerosis and stuff like that, they're simply, for lack of a more delicate way to say that, it is what it is. There's not much you can do in a particular claim like that is going to, we can't manage it any more than it's being managed right now to suppress it, right? That makes sense?
Yep.
Sure. Sure. So, but at the end of the day, if that is a road that we wanted to go down, we certainly could come up with some ideas that might, wouldn't be too demanding on the staff and hopefully not too financially overbearing. Maybe I could put it in a little better perspective on the wellness plans too. So I'll talk specifically about the Idaho school districts, for example. All right, they moved to a self-funded plan a few years back, right? And they're not doing anything on their end to develop any kind of a wellness program. Because at the end of the day, when they review all the data, see, a few years back, it was kind of a hot item to talk about, right? But when you crunch the data at the end of the day, and that's in reality, that's what a lot of these insurance companies do and a lot of these self-funded plans do. Does that make sense financially for us to do that, right? And at the end of the day, the answer to that is, it's not really. It doesn't. It doesn't make sense for us to do that. And that's why Blue Cross of Idaho, actually, the teledoc option that they had a couple of years, they implemented during the height of the COVID pandemic. Now, a lot of people would argue with him, kids with families with kids, they're really liking that idea. But when you look at the usage and the data associated with that, it doesn't pencil out in the eyes of the insurance company. So they discontinued that largely, right? So
not everybody's using it.
Exactly. Yeah. I mean, I see its advantages, definitely. If we had young ones, so I don't have to run down to urgent care or something like that, I definitely see the advantage of that. But, right? So, yeah.
Okay. Questions from the board? It's too early to tell.
Yeah.
Too early to tell.
But it smells like another increase because of the inflation.
Well,
that'd be more likely than that prices are going to drop.
Yeah, I don't foresee prices dropping. Yeah, unfortunately. And I don't know, for lack of a better way to say it, but for what it's worth is that if you look broadly across the spectrum, we manage and work with several self-funded plans as well as fully insured groups that are large employers. And the costs are just simply not going down. Everybody's about in the same boat. So we're not in a unique position here.
Mm-hmm.
Okay. One other thing I want to talk about too real quick before I forget is that when we last met, we talked about maybe adjusting the wellness fair date, maybe bringing that earlier on in the year than as opposed to later on in the year. And I know that you folks have all been very busy, and that's probably not high on the priority list.
I can't say that I have thought about that.
The only reason I bring it up is because I kept good notes from our last meeting, I think.
Yeah. And we usually have it in the summer months, or when do we usually?
Yeah, when did we have that last year? September-ish?
Mm-hmm.
Yeah.
I think it was somewhere.
Yeah, and part of that was a number of people have already gone in for their checkups and stuff like that. So, I don't know. I'll just throw it out there, and I can talk with Tammy a little bit and see what her thoughts are on that, and if we want to adjust that in some fashion.
Okay.
Okay.
Yeah, I don't have any objections
No,
to
I
doing
don't.
that. Moving it up earlier would help us how?
Well, I don't know if there would be, honestly, Dave, any direct impact on the county per se. As claims, I think where it would benefit would be the employees of the county, in a sense, in that, they can have their blood work and stuff like that done on site instead of having to go to the provider's office or something like that.
Well, we're always looking for ways to benefit the employees. So, okay. So I think Tammy would be the appropriate contact. Tammy's not here. Are you filling in for her today, or?
No, Tammy's here.
She is here? Oh, okay. All right. Well, I have no reason why we couldn't work with Tammy and move forward on that if you want to. I mean,
okay.
If it's going to benefit the employees, there's no.
Even if we send out like a survey, participant is low, so we would want to increase that. And
yeah.
See if we can get more people to participate in it.
I think summer would be probably easier because really September is our year end and we're kind of scrunched, and so I think maybe earlier, like July.
June or July.
June, July.
Okay, excellent.
Because August is budget time. And
one idea that we came up with a couple of years back was we, and I don't know why we didn't do this last year. I think it just having somebody at the lead and reorganizing because we hadn't had the wellness program for a couple of years, or the wellness fair. But we threw in, I want to say it was $100 gift card as incentive to participate in the wellness fair. And we had pretty good turnout that year. I even put in for it because it was a Cabela's card, so I thought I'd throw my name in there. But I didn't know. Just kidding.
For Cabela's, yeah.
I know it, right? So I think we can parlay with the gym plan, maybe Delta Dental, and maybe get some perks for the employees for that. So maybe incentivize more of them to participate in that. Okay.
Yeah, that sounds good.
Okay. Other than that, just touching base to see how things are going and not, have a real specific agenda.
Okay. Well, my only suggestion was if you could get some kind of blood pressure monitoring station here in the commissioner's office.
Okay.
Stick my arm in there and check it.
Sure.
On a more regular basis.
Sure.
That might save the county some money down the line.
Okay.
But, anything from any of you?
Not at this time.
no, not at this time.
Sure appreciate you taking time to keep us in the loop, because this is going to be a challenging year with the budget.
Okay.
And that's putting it mildly. Yeah.
Right. Okay. On that note, I always like to keep our options open, right? So, with all due respect to the gym plan, they have a good thing going there, but that's not our only option. We kind of got confronted with higher claims last year, and that equated into a lot of decline of quotes from the other carriers that are in our marketplace. So I always like to keep that open, and I think that that we look at that again this year.
I appreciate that.
Mhm.
Yeah.
Okay, to see how that looks. Okay.
Yeah, bottom line is how do we stretch the dollar to give the maximum benefit to the employees for what we've got
You bet.
financially. So,
You bet.
okay. Well, if there's nothing else,
I'm good.
No other questions?
I appreciate the information. Okay.
Thank
Well,
then-
appreciate your guys' time.
Do we have any public questions?
I think you already answered this. Compared to last year, we had a lot of high claims. It looks like we're down.
Yeah, compared to last year.
Yeah. From last year. And I guess what was the other one? You'll come back in April to do the rough number on the budget for the.
Yeah, probably around that timeline. Yeah. One thing that we've been challenged with in this whole industry, not just our agency, but as a whole in the industry, is the Department of Insurance has been backlogged tremendously on trying to get things done at the end of the day. Their staffing is down, and so what that means is that the GEM plan has to file their rates with the state of our Department of Insurance to get approval for that rate adjustment, whatever that may be. And at this point in time, we're right down to the wire on a number of things. So that has been a little bit frustrating because it's not giving us the timeline that we're accustomed to reviewing things and making the decision and stuff like that.
A
But
delay in getting their approvals to
It's-
them so
it's-
that they can move forward?
yeah,
Okay.
exactly. So, and I know that the GEM plan is cognizant to that, and they have already kind of, trying to tee it up with the Department of Insurance to get those numbers pushed through and that final calculation out as quickly as they can. So,
Okay.
yeah.
Interesting.
Last thing, they have the 2023 budget on the Iowa Association of County wages and benefits survey out now. Might be something to look to see what other counties are doing for what insurance they're getting. And I mean, I just looked at it this morning, but I didn't look at it that hard. But there is, what other counties are doing. Maybe they're saving money with some other plan that Tracey might know about. I don't know.
Sure.
Yep.
Yeah, I mean, that's all worthy dialogue. And this is, so we're at a $750 deductible right now, and that's being offset a little bit by the HRA contribution. From my perspective, and the amount of business that I deal with, I would say that the benefit plan that Shostrom County offers is a very good benefit plan, right? Is it the best out there that I've seen? No, but it's certainly by far from the worst. And kind of where I'm going with that is in today's environment, what we're seeing from employer groups is that even the smallest modification to a benefit plan, for whatever reason, is creating friction internally with the company and the employees. Right? So the employers are going, hey, we just want to do everything we can not to disrupt things because we don't want people jumping ship. And so that's been kind of a heightened concern lately with benefit modification on the plan. And I mean, there's a number of factors that are driving that. I think the inflationary food costs, gas costs, everything else, it's just costing everybody more to live. So if employers are, because the reality of it is to lower your cost on your health plan is you do have to modify your benefits, right? Go to $1,000 or $1,500 deductible plan or something like that. And I know that by going from a $750 to $1,000 deductible, let's call it 1%. You're probably going to see maybe a 1% adjustment in your overall bottom line cost. But what does that cost equate to the employees to have to take on that additional out-of-pocket cost, right? So those are some of the things that employer groups are weighing on their decisions to modify their benefit plan.
And we looked at that last year because we were looking at, raising the deductible, and it
Yes.
really did not have a substantial benefit to the county by lowering the costs weren't really, it didn't really,
It didn't save us
didn't save much.
Yeah. Yeah, one of the frustrations. And another thing that we looked at last year, a common practice, is employers putting in a dual choice plan, right? Typically a higher deductible plan, let's call it a $2,000 deductible plan, and the employer says, hey, we're going to pay 100% of this plan. If you guys want to keep the $750, you got to pay that premium differential for that cost, right? That's a pretty common practice. But as we found out from the GEM plan last year, they don't allow that within that. And there's some actuarial reasons for that, is because we have what we call diverse selection within the insurance business. The employees that really utilize the benefits will migrate to that lower or richer deductible plan. So that drives a little bit of unbalance within the two plans. We know that, and that's GEM plan's position on that. So, but
It just lists what plans are with
the other counties.
It lists the different cost to the employees, cost to the county.
Sure.
Just something to look at. There's other stuff out there. So.
Absolutely. Yeah, I'd be happy to do a little research on that and see what the other counties are doing. For sure. Yeah. That's
Savannah, did you have a question or comment? Okay.
sure.
Well, she sat right behind you with the camera too, so yeah. I got her figured out. Okay. Well, thank you.
Thank you,
We're
guys.
going to have to be creative this year.
Yep. Okay.
Budget-wise, we're going to be extremely tight, so we're just going to have to be as creative as we can. So exploring, there's nothing wrong with exploring all options.
Okay.
Try and do the best we can for the employees with what we've got.
Very good. So we'll make it happen. We'll flip over every rock that we can to see where we can find some savings.
All right, appreciate it.
Well, thank you guys.
All right. Well, then we'll stand adjourned.